Hi, Becca C. Smith here, and today I am going to talk about how my surgery went and then the aftercare nightmare that I had. Trigger warning if talking about surgery or blood, vomit, any kind of thing like that, I suggest you do not watch this video. And for those of you who don't want to watch it, I totally understand. It can be very triggering talking about these things. So just so you all know, the surgery itself went perfect as far as we know. I am doing better and I'm getting better and better every single day. And so as far as that goes, it was successful. So for all of you that don't want to hear all the gory details, thank you so much for watching, even if it's this short amount of time. And I totally understand. And I'll see you in the next video. Okay, but for those of you that want to know the whole shebang, this is how it went down. So I'm not sure if I said, I can't remember. I probably did in like streams and things like that, but I had to have surgery because I had a cyst on the left side of my uterus. Now I've had this cyst for over a decade. That's just the first time they found it a decade ago. But I had, the reason why I had surgery, endometriosis, very severe case of it. And this was what's known as, I think it's called like an endometra. Basically, it's a cyst that's caused from endometriosis. But as long as you keep an eye on it, which I did every 6 months for the last decade, so that is something I don't have to do anymore, which is kind of awesome. And they keep an eye on the size, and as long as it stayed within its range, it was safe, it's non-cancerous. But last November, it had grown. And it's still not like, they were still 99% sure it was non-cancerous. But when a cyst that's been pretty steady for 10 years grows suddenly, it's, it can be a cause for concern. That's when my gynecologist recommended that I talk to a surgeon. And she gave me a recommendation. He was fantastic. I met with him, he looked at all my files, and he suggested that because the cyst is so big and it's been embedded for so long in the endometriosis, that I actually get a partial hysterectomy. So basically I would just lose the left side of my uterus, which is where the cyst is, because he pretty much was like, if we take it out, it's just going to come back. But the surgery was also going to include removing my endometriosis, which, if you know anything about endometriosis, you know that oftentimes it doesn't just stay limited to the girdle area. Sometimes it can spread to other organs. The surgery itself is laparoscopic. In this case, because they had to look at like my organs, everything, I have 5 incisions down here, and then they fill you up with gas so they can see everything. And yeah, so my endometriosis, it was on my bladder. It was pretty extensive, but it's all gone. So that's that itself. So all the surgery stuff went well. This guy is one of the best in the business. Thank goodness my doctor knew him enough to get me an appointment, because let me tell you, it was really hard to get an appointment, but it was well worth it. It's my aftercare that was the nightmare, the hospital that I stayed at, which we are going to be filing an official complaint because of what I'm about to tell you. Okay, first off, when I went, I had gone to do the pre-op with the nurses. So that's where they get you COVID test, they take some blood, and you kind of go over everything you're supposed to expect on surgery day. This was a couple days before surgery. And so the nurse was very nice. I told her, she's like, do you have any allergies? And I was like, I do have penicillin. And she's like, oh, okay, because the antibiotic they have for during the surgery, when, through the IV, she's like, this is like a cousin of penicillin. So maybe, just let your anesthesiologist know that you don't want to have anything related to penicillin. So it's like, okay. Now this is the thing, is that I think this statistic is ridiculous. Like 98% of people who think they're allergic to penicillin actually just have an intolerance or sensitivity to it. So this particular antibiotic, I think it's called sulfoxaflor, is like a distant cousin. So it doesn't affect people that have intolerances or sensitivities. It's actually fine to use. But I have a severe allergy to penicillin, which again is like 2% of the population. But the problem is anesthesiologists and most doctors do not believe you, because so many people have been drilled in their head that they're allergic to penicillin and they actually aren't, that they're so used to hearing it that they just ignore you. And this actually happened to me on a surgery I had. It's outpatient. I was in the hospital because they gave me sulfoxaflor, the same stuff, okay? Since I am severely allergic to penicillin, any cousin, anything related is very bad. I didn't know they were gonna give it to me because I told them I'm allergic, and they're like, okay. And then they give it to me anyway. I don't understand. Like, even if there's a chance, why would you give them any kind of cousin of penicillin? Like, even if they do just have an intolerance. This is on my previous surgeries. This didn't happen in this surgery, thank goodness. But my previous surgery. So they'd give me sulfoxaflor. I was vomiting like The Exorcist. It took me 2 weeks to recover. I mean, the first few days, my husband and my mom had to spoon feed me because basically they had poisoned my body, because I don't get anaphylactic shock. That's not the kind of allergy I have to penicillin. I have the kind where my body and organs will shut down. It's because my cousin had the same allergy and she passed away because they gave her penicillin in the hospital when she went in for pneumonia. It's just like a total shutdown. My body shut down. And so this just cousin of a cousin of penicillin wrecked me for 2 weeks. So the fact that they had this on to be scheduled for my antibiotic, I was like, no, not again. So the day of the surgery, the anesthesiologist came up to me. I told him, I mean, I have a bracelet. I don't have it with me because I don't go out that much. But when I go out, I have to wear a bracelet. It's a Med Alert bracelet that I'm allergic to penicillin. I told him, I said, I've been tested. I've gone to an allergist. I have a severe penicillin allergy. I cannot take sulfoxaflor. He still was like, oh, well, a lot of people think they're allergic, like the whole spiel again. I'm like, no, I am allergic. I have been tested. And look, I even brought my old surgery notes. I was like, look, I can show you. See how they gave me sulfoxaflor? I was vomiting and sick for 2 weeks afterwards. I cannot have this in my system. And he's like, like he looked like I had just asked him to, I don't know, reschedule his whole entire day. So he's like, okay, hang on a second. And so he left for like 20 minutes. And I'm like, how is this a battle? How? So he came back and he's like, okay, I'll give you Cipro, which I've heard so many things about. But at this point, I did not want to argue. I was like, fine, I will take Cipro. It's just during the surgery. Hopefully I don't have a reaction to it. I didn't. Thank goodness. So that was the first battle, which I won. Yay. So I woke up feeling groggy, feeling kind of Unfortunately, when they do fill you with gas, some people get a reaction where it hurts the nerve in like I forgot which area, but basically it'll affect your shoulders. It basically made me, and of course it happened to me, but that's not anybody's fault. That just happens. It basically feels like your shoulders are broken, like they've just snapped, and it's so painful. Luckily, walking, drinking, I kept I was even walking after surgery, like I was just, okay, here we go, I'm trying to get rid of this. They said this is how it gets rid of, so I'm just going to keep on walking. And I'd say by the next day it was almost gone completely, so that was good, but that was annoying. Again, no one's fault. That happens. Okay, so now to actual people's faults of the aftercare. So I had this nurse. I'm not going to say her name because we're actually, like I said, filing an official complaint. She should be fired. What's weird is that she's actually was in charge of all the nurses in the aftercare area. I've had this problem with my previous surgery where I can't urinate, and they won't let you leave the hospital until you can. I couldn't, so they had to do a temporary, they you know, checked my bladder, saw that it was full. They had to do just an in and out catheter so that they could relieve the bladder and then hope that I could, throughout the day, stay there a few more hours and be able to go to the back, pee on my own. I've had catheters before, and they're normally not, I mean, they're uncomfortable and weird, but they're not painful, right? This nurse, she kept stabbing, you know, the tube that's supposed to go up the urethra? Stab, stab, stab. I was, you know, I am a quiet, shy person. I was swearing. I was like screaming. I was like, what the? And because you're in this sort of like at this person's mercy, you don't want to be mean to them because you don't want it to be worse. So, you know, inside I'm going, what the heck are you doing? And outside I'm just going, you know, and like saying bad words. And she just kept stabbing. And I'm just like, oh my God, what is wrong? Finally, after probably 8 to 9 very aggressive stabs, she got it up. I don't even think there was lubricant on it. So it was very painful. Like involuntary, you know how you're just like crying without crying? Like even thinking about it, I had nightmares for weeks after the surgery. Ugh. And this is supposed to be something stupid and simple, like easy. And I've had it before. So it's not like the stuff of nightmares, right? But it was so traumatizing. And then she says, this is what she says afterwards. I just couldn't see. I guess, you know, I should have brought a flashlight. I'm just sitting there in shock, just going in pain because now the aftermath of it is painful. And I'm just like, okay. And then she relieved the bladder and then yanks it out, right? Deflates the bubble, deflates the balloon and just yanks it out. And I'm just like, I am just in shock and just, I don't even know what to do. I'm in pain and so, but again, I just got out of surgery. I'm still groggy from the anesthesia. I was like, okay, whatever. It's fine. I'm just gonna move on and hope to God that I pee and I don't have to get another catheter in me. So fast forward 6 or 7 hours and I still can't pee. And this is when we decide we're going to be staying the night, which of course, when we say we're going to be staying the night and realizing that I'm going to have to get another catheter, she's like, would you like to go home with the catheter or would you like to stay the night? And I said, well, just in case, I'd like to stay the night. She's like, why? I'm all like, you know, I just want to stay the night. Just like, I'm so over you, lady. And I already know that this is, you know, I'm hoping. I still have faith. That maybe she just literally couldn't see, you know? Because the second time we're putting in the catheter for overnight, she brings a flashlight that she has the other nurse hold. So I'm like, okay, this gives me a little bit of hope. I'm going to be done with this woman and just be in another area where I stay overnight with hopefully better nurses, which they were. So the other nurse is holding the flashlight. She gets the catheter ready, and then again, stab. And I was like, what? I finally was just like, what? I can't, like, what's happening? And then she laughs again, even though I'm crying in pain from her stabbing me with this thing and missing every single time. And she goes, oh, I guess it would help if I wore my glasses. And I'm just like, my legs are shaking like this, just like thinking, just fucking get the thing in, just get the freaking catheter in, just get it in, just get it freaking in. And finally, she does. And I'm just like, if I never see this woman again, I will be, and if she did this to me, it just makes me think that she should not be a nurse. And what else is she doing that is just not professional or caring or anything a nurse is supposed to be. She drops me off to my room. Actually, it was a very nice room, and the nurse that I had for overnight was so sweet, so nice. I was just like, she like just literally felt like an angel. I was just like, who are you? I love you. Like, she was so wonderful. So that was nice. I needed that. I needed something to calm me down. And the next morning, she took out the catheter to see if I can again urinate on my own, and I didn't even feel it. I was like, oh wow, she knows what she's doing. Waited a few hours, still couldn't pee. So I had to get another catheter that I was going to have to bring home with me. So I was actually okay. I was like, you know what? I'm just going to have it in for a couple days. My doctor or the physician's assistant, because this guy, like I said, he's a surgeon. He doesn't really do anything except surgery. So I was going to, we scheduled a couple days, and then I was getting it out. I was like, all right, fine. You know what? It's just give my body a rest, and hopefully I'll be okay. Although, the OCD part of me and anxiety part of me is thinking I'm never going to pee again. But, letting those voices go, so the clouds, pushing them away. And then the second nurse, the day nurse, a new nurse who was also very nice, she put the catheter in, and guess what? It didn't hurt, because she knew what the heck she was doing. I mean, it hurt a little because I was sensitive to that area from the previous nurse, but barely. I was just like, oh, it's in? Like, I was just shocked, because in a good way, because it didn't hurt. So I was like, okay. So everything seemed to be going great. I was like, okay, I'm just going to bring this home with me. I was actually starting to feel good and positive and just get me home so I can heal and relax. But as we were about to kind of get the ball rolling with getting discharged, the nurse looks over, and one of my sutures has opened. And so they put like this plastic bubble, like Band-Aid, I guess, over it, and it was completely full of blood. It looked like a weird leech of blood. So she had to take that off, and of course then it just started bleeding. And so I had to hold a gauze pad on it and put pressure on it we tried for like an hour, just to see if it was a surface thing that we could just get it to clot, and and just bandage it back up and be done. But when an hour and 20 minutes went by, I was still bleeding. And so my nurse was like trying to call my doctor, and then she came back and she said, I talked to your doctor's office and they want you to go to his office so they can fix it there. I'm all like, what? Like, I'm literally holding blood. Like, blood is coming through the gauze as I'm holding my stitch up like this. And I'm just like, well, why can't we fix it here? Like, while I'm in the hospital? She's like, I don't know, because we got to discharge you and your doctor wants to do it at his office. And so I'm like, oh, okay, is it because, he's a surgeon and he's worried that maybe there's some internal? She's like, I don't really know. I just talked to his office and they want you to go there so they can fix it. So we're going to discharge you. And I'm all like, okay. So they discharge me from the hospital bleeding. I'm literally leaving the hospital holding in my surgery as blood is coming out of the gauze bandage. And I'm trying to get into my sister's Prius, which is low to the ground. It's hard to move because it's all in your abdominal area where you're up and down. And so I'm literally trying to hold on to the thing and getting in. Finally, I'm just barely sitting there, and everything hurts. And then we get over to his office. I'm literally kind of limping in. Remember, I have a catheter hanging out of my freaking... like walking with a catheter, holding my wound. Get to the doctor's office. It's empty. There's one person behind the desk. Doctor's not in. They have no idea why I'm there. No one called them. The nurse was either lying or talking to a different office and got confused, and somehow that secretary got confused and told her for me to come over. And yeah, they had no idea why I was there. And to be fair, they brought in people from behind, and then thinking, fuck, like I don't even know what to do. So then they try putting pressure on. I'm like, I try to tell them. I literally was putting pressure on for an hour and a half. It's not going to stop. They're like, well, we have to try. And so I was like, okay. So they're like, finally, when they realized I was still bleeding, it wasn't going to happen, it was not clotting, which of course makes me think then it's internal, right? Finally got a hold of my surgeon. And he was like, she has to go back to the ER, to the hospital that discharged me. I have to go back to the ER for them to fix it. But they're going to try and fast track me, right? So I have to get into my sister's Prius again with a bleeding wound so that I can go to the ER. So I got into my sister's car. At this point, I'm kind of in what I call coma mode, where I'm just so over it and just want it to be done. So they said they were going to fast track me. It really wasn't fast tracked. I still had to wait in the waiting room for quite a while with all the other people. Finally, they got me back there, though. I kept asking them, it hasn't stopped with pressure, so should we do an ultrasound just to make sure it's nothing internal? No, we don't think it's internal. That's the confidence that I got from them. It's like, okay, but should we check just to make sure? No, we're just gonna glue it, glue it together, right? With some, surgical glue. So that's what they did. I made a Jack Reacher joke. I said, oh, I'm like Jack Reacher. No one got it, but thought a good dad joke might bring a little levity to the situation. It did not. So they glued me up and sent me home. And as far as I know, it wasn't internal because it's been 4 weeks. Yeah, 4 weeks tomorrow. And everything seems to be fine. I didn't have any bleeding. I didn't have any fevers. Like, everything seems to be healing the way it's supposed to. So it probably was just what they thought, which was just like a burst blood vessel that, just needed to be glued shut so that it could cauterize and heal up. But that was my experience. So yeah, on a level of aftercare, it really was it was traumatic for me. And I am going to be, like I said, I am going to be filing a formal complaint against the nurse at least. Also, the fact that they signed me out without a doctor's signature, they just literally discharged me bleeding. That doesn't seem right? I mean, I'm not crazy here, am I? Do you think you should discharge a patient, especially since the ultimate solution ended up being their hospital's ER doctor gluing me up? If I had just stayed in my hospital bed and had a doctor come in and do the same thing, I would have been fine. Like, they would have come in, they would have glued me, they would have held it there until it stopped, and then I would have gone home. I wouldn't have had all of this other crap. So, obviously a little disorganized. Yeah, I don't know where that's going to lead, but I'm sure I will keep you guys posted on everything that happens. Because, by the way, we just got a giant bill from the ER, right? So I have no idea. We're not going to pay it. Like, that's just not happening. So we are going to fight that for sure, because I should not have had to go to the ER. But, like I said, I will keep you guys all posted. And that is one of the reasons why I have not been on YouTube. I've been trying to take care of myself and heal. And it's very hard for me not to do anything, because I just always feel like I should be accomplishing things, which I know can be a very negative mindset. So I have been trying to keep myself relaxed. It is very hard for me to relax, but it's actually been a really good month for sort of teaching myself that it's okay to take breaks and even take days where you don't need to do anything and stuff. So I've had a full month of actually really taking it easy. I've done some outlining on the second book of Hexsphere, but that's about it. And I'm okay with that. Like, I'm actually getting beta feedback from my betas for the first Hexsphere. That's been so helpful. So that's exciting. And that's it. So I am going to be doing an experiment in the next couple days. So I'm probably going to film that as a vlog. So hopefully you guys will be into that. It's kind of crazy, but I think it'll be fun. I think I'm ready. I think I'm ready to just I'm not going to go crazy. Like, it is a crazy goal, but I'm going to make sure that I don't overdo it, because I'm doing so much better. I do not want to ruin that progress. But thank you guys so much for watching, and I will see you in the next one.